Today, they are supporting 22 medical test sites and 8 food bank operations. To date, they have administered more than 272,000 COVID tests in the state of Louisiana from this community testing effort that the National Guard has been responsible for. And that brings me to today's COVID-19 update, which unfortunately continues a disturbing trend that we've seen over the last number of days. Today, we're reporting 2,073 new cases on 27,961 new tests. Tragically, we are also reporting 15 new deaths. That's a total of 6,199. We have 929 individuals hospitalized with COVID-19 across the state of Louisiana. That is an increase of 43 from yesterday. And for this week, it's an increase of 253. So that is the number, that is the metric that is most concerning to me. And obviously, it pains me greatly every day to read the death numbers. But what we know is that the more people in the hospital today, the more people that we're going to be reporting as a death 2 weeks, 3 weeks from now. And quite frankly, the increased hospitalizations are very concerning. And it's increasing at a rate that we just can't sustain over time if we're going to retain the capacity to deliver life-saving care, not just to the COVID population, but to the non-COVID population as well. Of the 929 individuals hospitalized with COVID, 88 are on mechanical ventilators. That actually is a decrease of 5 from the previous day. And I will tell you, there have been some pioneering work by doctors here in Louisiana and elsewhere around the country so that the percentage of COVID patients hospitalized who actually transitioned to a mechanical ventilator is much lower than it was early on in the pandemic. And that seems to be having a good result. That may be something that you'll hear from in just a minute from Dr. Thomas, I'm not sure. Test positivity is up as well. We're now at 7.5% positive on tests statewide. That's up from 5.8% on November the 4th. And that may sound to most people like a small increase, but understand these are percentages, and really when that positivity starts going up, that's when you start seeing exponential growth in your numbers. That's the real challenge. But there are many parishes where the positivity rate is actually in excess of 10% currently, and a few that are far above 10%. So the bottom line is this: make no mistake, Louisiana is in the third surge of this pandemic. On Monday of this week, I was on a call with the White House Coronavirus Task Force. And given the growth in cases in hospitals around the country, they let us know that this surge is clearly worse than the first two. And it is nationwide. It is not isolated to certain areas of the country. I think we've now eclipsed 11 million cases nationwide, 250,000 deaths. I think just yesterday was 1,800 deaths. So case growth and hospitalizations are the highest yet in the country. And Louisiana is a few weeks behind the rest of the country on this surge, but we are in that surge now. It's the behavior change that really fed into it more than anything else, because we know that sometime around Halloween, more individuals let their guard down, stopped distancing and wearing the masks when they were around people who were not part of their immediate household. And we know that there were more businesses and patrons who were paying less attention to the restrictions that were in place. And our numbers have deteriorated as a result of that. To put it into a little more context for you, the White House report most recently for Louisiana, and these are state-specific reports, puts Louisiana as having 172 new COVID cases per 100,000 people. Now, there's some good news, I guess, relatively speaking. That's below the national average of 294 new cases per 100,000 people. But just a week ago, we had only 99 new cases per 100,000 people. And I just told you we're up to 172. So it clearly shows you how in a very short period of time, our numbers have deteriorated. And we are seeing strong new case growth. A lot of things worry me, but one of them is that we know, both from the scientists, the doctors whose life work is around these pandemics, but also from our previous experience, that anytime your numbers are going backwards, you're worse off than your numbers would lead you to believe at any given time, at any given snapshot. And that's for a couple of reasons. One is that increases are exponential in a surge. They're not uniform. So if you add 25 people to the hospitals today, for example, you might say, well, we're going to add 25 more tomorrow. That's not the way it typically works. It grows faster than that. Secondly, assuming that you can change the behavior in a way that is helpful, that will flatten the curve, if you changed all the behavior today, you're at least 2 weeks from seeing that bear fruit. So the trajectory you're on at any given time when you're going in the wrong direction is what you can expect for 2 weeks. And that's why you have to make decisions early on before the data tells you that it's absolutely essential. Because if you wait until the data tells you you have to act, there is every chance you waited too late. It's also, for a little more context, there's no doubt in my mind that what's happening now is a result of what happened a few weeks ago. And quite frankly, it's sad, but there's nothing we can do to change it. We had been in a plateau, more or less, for almost 3 months. But then we came upon Halloween, and I think people decided they were going to have their normal Halloween parties and get-togethers and so forth. And just in advance of that, a number of Republicans in the House passed or signed on to a petition that purported to end the public health emergency and end the mitigation measures and the restrictions, and caused some confusion for people who were already had COVID fatigue. They were looking for some reason to not engage in these measures. And in fact, some of these members and others advocated that people not heed the restrictions and mitigation measures. Although we know now, as I said all along, that petition was invalid. The statute upon which it was based has been ruled unconstitutional, but our numbers have nevertheless deteriorated, as I mentioned, and case growth, positivity increases, hospitalizations, and all of it because of that. And we need to do better. Quite frankly, leaders need to lead. And like the rest of the country, you know, we're not just talking about large gatherings anymore. If you've seen the White House Coronavirus Task Force, over time there's been increasing emphasis on small, informal gatherings, even gatherings of extended family in the privacy of one's home, driving large increases in COVID across the country here and here in Louisiana, I should say. Recently heard about a story, it's a family in the Shreveport-Bossier area. They got together for a single family dinner. Not friends, just family. Extended family, but they didn't come from one household. One of the family members had COVID, but nobody knew it. And that is the danger of having asymptomatic people with COVID who are nevertheless contagious, as 40 to 50% of all people with COVID are. So the dinner led to 8 more family members getting COVID, 3 of whom had to be hospitalized, and 1 of whom, the father, very sadly died. Now that's happening more than that one instance that I just referred to, and it's happening all over the country and all over the world. But we know that it's happening. And there are some common sense things that work that prevent this. And they are the things that we've been talking about for a very long time. things that have been proven effective at flattening the curve twice before when we were surging, and it's exactly what we have to do again now. And I hope it's not lost on anybody, that example that I just gave you 1 week from Thanksgiving. And I'll say it right now in case I forget later. If you're planning on a Thanksgiving that looks like previous Thanksgivings, where you bring extended family, friends around a common dinner table, you're making a mistake. It is just a mistake. And nobody's trying to punish anybody. It's unfortunate. Nobody likes large family gatherings more than I do. Even in difficult times like 2020, we have much for which to be thankful, and I believe in giving thanks. And we can still do that. And we can find new ways to be connected to our family and to celebrating with them. But we ought to love our loved ones enough to not want to expose them to the dangers of COVID. And given the degree of asymptomatic transmission, nobody can feel comfortable that they don't have it and won't transmit it. This morning I had a call with hospital CEOs from around the state. It should be no surprise to anyone, given the numbers that I just talked about, that they painted a fairly grim picture. And they, too, are aware that things are going to get worse before they get better. But how much worse is up to us? And how soon things get better is also up to us. There's increased hospitalizations, as we discussed. There is concern about capacity. The concern doesn't revolve so much around beds, although we keep a close eye on beds, whether they're ICU beds or surge beds, whether they're adult beds or pediatric beds, all of those sorts of things. The concern we heard in every region of the state is about staffing. Do we have the doctors, the nurses, the respiratory therapists, and all the other healthcare professionals needed to deliver life-saving care? And by the way, not just to COVID patients, but to non-COVID patients, because the census in our hospitals of non-COVID patients is back to pre-COVID levels. But they have to be in the hospital too. And the reason staffing is a problem is really twofold. One, anytime you have significant community transmission of disease, the disease is being transmitted to doctors and nurses and therapists and others who then can't go to work because they have to isolate, or maybe they've been a close contact. Secondly, because this is a nationwide surge, which state is going to give up its doctors and nurses and therapists to come to Louisiana to help us? We can't count on it this time, which is why we have to do everything we can now before we get into position where we don't have the capacity to deliver care. So for more on what we are seeing in our hospitals, I should say, I'm going to ask Dr. Thomas to come up. Dr. Thomas will be followed by Dr. Cantor. I would encourage you to ask questions of these doctors while they're at the podium, if you'd be so kind. And then once Dr. Cantor is finished, I will come back up and finish my remarks, and I'll take your questions as well. Dr. Thomas?
Initially, I'd like to thank Governor Edwards for the opportunity to speak to my fellow citizens of the state of Louisiana. I would also like to be very clear that I represent 26 physician colleagues in the city of Baton Rouge and all of our teams as we look at the oncoming surge of patients to our hospitals. In introduction, my name is Christopher Thomas, and I am a critical care physician with LSU Health at Our Lady of the Lake. Since early in this pandemic, I have been part of teams treating critically ill patients in our intensive care units here in Baton Rouge. Our teams include extraordinary nurses, unbelievable respiratory therapists, pharmacists, and an often under-recognized group of environmental service professionals who have attempted and been successful in treating the sickest patients of our careers. In that role, I've witnessed our adaptation to the disease. I've witnessed us work together with colleagues around the country to try to decipher how best to treat our fellow citizens, to have conversations about what best practice is, and to try to understand a disease that we had never seen before. Unfortunately, I also have another role, and that other role is that I transitioned into a patient. And so as a healthcare worker, it's one of the things that you have a challenge to think about, is in this disease, what happens to you in your exposure? Now, luckily, I myself had symptoms of muscle pain, high fever, and shortness of breath. I fortunately was not required to be taken care of in one of our ICUs. I fortunately had the medical knowledge to understand that I hopefully would be better. But I will be very honest and say I am not ashamed to say that I had fear upon the diagnosis, that I had seen critically ill patients in my hospital not be able to survive, and I was given that same possibility. I think that is real. I think it is logical. It is science, and we should recognize that possibility when we think about our loved ones. Since the beginning, I've watched our teams perform heroic acts. I've watched them maintain a level of care for our community that I am just simply, to use one word, proud of. Our nurses have done an unbelievable job, but they are tired. Our respiratory therapists have done a fantastic job, but they are tired as well. Unfortunately, I regret to tell you that the stress on the healthcare team and certain individuals has become too much, and despite their career aspirations to take care of those that are sick, some have decided to leave the profession. I don't blame them. This has been a pandemic that none of us could have seen. But what I will tell you is those that are remaining are committed, they are educated, they are dedicated to the citizens of Louisiana, and that includes the entire state. We have weathered 2 previous surges. We did this in March and April, where our knowledge was less. We did it again in July, where our knowledge was better, and we are prepared to do it again, if forced to, here for our citizens. With that being said, our plea is very clear. Please, let it be less. Please do your job and think about this as a real impact to your families. At the current pace, we have made strategic movements to advance our therapies. As Governor Edwards stated, we have moved away from things like ventilators and into advanced oxygen devices. We are playing a much more significant role in therapeutics. We have some medicines that now work. We are confident in that. What we are also confident is that if the number of patients overwhelms our current staff, the ability to deliver that excellent care day after day will be limited. Please, don't force us as healthcare professionals to make that decision. No discussion about COVID should ever be undertaken without a conversation about a patient. And so as a result, as an ICU provider, I would like to tell you a story about one of my favorite patients who presented to our hospital, no known prior health conditions, father of 2, one, both in college. He transitioned from the floor to our ICU on hospital day 3 and was put into our COVID isolation area, and we watched. Because at the time we took care of him, there wasn't any clear therapeutics that we had available. And the team monitored him for 14 days. And my patient went from his stomach to his back, to his stomach, to his back, and back and forth for 10 days. And we had conversations about the things he enjoyed, his children, what he wanted them to do, and we had conversations about his death. Thankfully, he's a patient that as of today survived this illness after 14 days. And 6 weeks later, when he was still short of breath, he began to ask the question, will I ever feel normal again? And my answer to him as a pulmonary and critical care doctor was very clear and very simple. I do not know. Since that time, he's improved, and so he's one of our COVID survivors, and we're proud of the care and delivery that we gave him. Unfortunately, he does not represent all the patients that I've taken care of. COVID is a disease that changes patients' lives and families. There will be holidays this year that will be different for some of our citizens in Louisiana. There will be people who will not be at those tables. There will be people that are not there. It will be different. So with that being said, the story really relies on two major focuses. Number one, healthcare, and number two, family. So let's address healthcare. While the public has not gone to medical school, while they have not gone to nursing school, while they not have all gone to respiratory therapy school, nor are they cleaning each of these ICU rooms hour by hour, day by day, you are now healthcare providers. You have a job. Part of healthcare is preventing disease, not just reacting or treating disease. So for every citizen in Louisiana, looking at the curve as we currently see it, you are now healthcare providers. And in your job as a healthcare provider, as you look at providing the care to your fellow citizens, whether that's at work, whether that's at home, whether that's in any environment that you interact, you have a couple things to do. Number one, you have to recognize that the science tells us, in my experience, and my patient's experience, that this is real. It will and has the potential to impact every single family in Louisiana. As I say that, that means that if you look across at your grandmother or you have a phone conversation with your parent, you have to think about what you would do for them to keep them from getting sick. And those things are very easy. Distance from them, as hard as it is, in times where you have challenges and you want to hug and hold someone, understand that outside of single households, that's not possible. So distance. Wash your hands. Wash them more than you've ever washed them before. Wash them over and over again. Wear a mask. We've done it in surgeries to protect you for years. You would never want a surgery where the surgeon was not wearing a mask. The science is clear. Wear the mask to prevent the spread. And finally, think about the impact of those preventative measures and look at the success. What does success look like as you are now healthcare providers? It looks like no one you love and no one that you have had any significant relation with, whether that's in work or at home, gets sick. You're in control. You are now a preventative medicine person. Congratulations for that role, and I know our citizens will be successful. Second to that, as a healthcare provider, it means you have to be able to look at the curves and recognize what Governor Edwards has said is real. At current pace, we will not have the capacity to do this again. We will have challenges in staffing. I know we can do it if the number of people that is sick is small, and so your job is to keep that number small. And then finally, it's family. And family means that in the state of Louisiana, we have to be assessing our risk with each other, and it means we have to be engaged with our families to help them in times that are troubled in some mechanism that's different to us, whether that's a Zoom meeting, whether that's a telephone. Tell them you love them, tell them you're here, and tell them because you love them, you're going to stay away, and you're going to wear a mask, and you're going to do it for them. In closing, my healthcare workers want to thank you in advance for what you're going to do for us. We want to thank you in advance for being very supportive of us during this entire time, and we want to thank you in advance for recognizing that at times we're now extraordinarily tired, but we are extraordinarily committed to your healthcare. Yeah, When we talk about staffing, we think about beds as physical space, but in order for me to take care of someone with my team in an ICU, I need all the members of the team to be available. When we think about that in staffing, in the last 2 surges, we asked for and received assistance in order to increase the number of staff who came to take care of patients in beds. As Governor Edwards said, we have the beds, but what we don't have is enough nurses for all of the beds in all of the hospitals in the state of Louisiana. And without the resource of others coming to staff those open beds, there's a limit. So, as of today, seeing the surge, do we have enough? Yes. If the projections are accurate, and if we do not bend the curve, am I concerned? Yes.
As someone that's on the ground level, how concerned are you for the 2 weeks after Thanksgiving that maybe some of these measures won't be needed and that this surge will only be made worse?
I think I'm more concerned than I probably would have been based on the experience in October. We had been able to reach a plateau, and in science you look back to see examples and the predictions. And the reason I think I'm standing here today as a representative of the ICU community here is that our example tells us in the curves that we didn't do those things in October, and if you add to them in November, that means that the amount of ICU patients could be in the hundreds. That's a significant challenge. None of us were trained to take care of that many ICU patients. And when you do your best, that requires your best team. We wouldn't ask the LSU Tigers to play a football game against 3 other teams at the same time and allow them to substitute in their best players. So from a healthcare perspective, I need to have my team, and I need to know what my opponent is. And the concern is that the opponent will grow in both size and volume so that we won't be able to do our best work.
With this surge and the way that things are moving right now, in your medical opinion, do you recommend some type of shutdown or us going back to another phase?
Yeah, I think those kind of questions are ones more for the governor than they are for a physician. My goal is in science, right? And the science is what we follow, and the evidence-based literature is what we follow. And the evidence-based literature tells us this: we need to change our behavior. And that, I think, is the most important. The ramifications of not altering our behavior then require actions. But the science tells me that if we change our behavior, if we legitimately and honestly treat each other as healthcare providers and treat each other as family, that it makes no sense to do anything else. So I have to believe that we can do that. So the science tells me we should do it, and my role as family of others tells me we can.
At this point, 8 or 9 months in, are you still regularly encountering patients who don't believe this is real or who have been skeptical about whether or not COVID is just flu-like? I mean, are you still regularly encountering those kind of patients?
I think our patients in our community is scared. When you're scared, your coping mechanisms are different. Some of us move to trying to state different things, right? Our reality becomes different. And so if you ask me, do I still have patients and patients' families who tell me it is not real, the answer, unfortunately, is yes. What I tell myself is each of us has to have a coping mechanism. For this audience, the reality is this is real. We've taken care of the sickest patients of our entire career. We will continue to take care of them. And on the flu, this is not the flu. The evidence-based literature tells us that this is much more dangerous from a respiratory illness perspective than the flu is every year. I have lived through and treated through pandemics, whether that was 2009 or 2012, as an ICU provider. This is worse. The severity of the illness is worse. And so when you get to the ICU, there are levels of acuity of illness and the numbers that are dramatic and require our fullest attention. So to be very circular on that answer, I wish everyone at this point would be past the idea that this is not real, but I accept and give grace to those who use that as a coping mechanism in order to really be able to live their day every day because it's something that's out of their control.
Tell us which hospitals are most at risk in terms of staffing or capacity?
Every single one. I think we spent a legitimate time in the first two surge isolating to regions. We looked at where maybe our colleagues in a different area of our state, whether that's Monroe, Lafayette, whether it's here us in Baton Rouge or New Orleans, had different levels. The reality is when you look at the state map, each of our regions is elevating. And that's unique because in prior times, we did trail each other by weeks. Currently, if you look at Monroe, they have a significant basis of patients currently in the ICUs. I talked with my colleagues there at St. Francis Medical Center yesterday. And when you look throughout the state. And so we were afforded the opportunity in the first two surges to potentially mobilize patients to higher levels of care. If the surge continues as uniform as it is, that opportunity will go away as well. And so I'm not being flippant when I tell you every single one. I'm actually being honest in the idea that the entire state is at risk. The other reality is healthcare providers in the sickest patients need to have an elevated understanding. The resource of pulmonary critical care and ICU nurses is not unlimited. And so we would like to have the opportunity to take care of the sickest patients as possible. It's an extra level of training, and we're proud of that. But it does mean that if the surge comes, it is possible that you wouldn't have afforded that expertise. We communicate, we strategize throughout the state, but it is a reality.
Good afternoon. Thank you, Governor. Thank you, Dr. Thomas. I'll tell you one of the things that I certainly am thankful for this year is my colleagues in the medical profession who have never stepped up more like this and really shown what they're made of. Dr. Thomas and your colleagues at Lady of the Lake and Dr. O'Neill and everyone else, just tremendous service to the community. I know every hospital in the state has done that. So that'll be my thoughts next week. We are in a rough place, and the concern is that it's going to get worse. I think people should be clear about that. So we're seeing increases in cases, every state in every region in the state, increases in hospitalized COVID patients, every region of the state. This is the beginning of our third surge. We are squarely in it right now. I think for the past few weeks, we've had some comfort in Louisiana, holding steady while the rest of the country was experiencing increases. Luck has run out. This is our third surge. And so people's mindset needs to change. This is an all-hands-on-deck effort. We need to be doing everything we can now to revert this because as both Dr. Thomas and Governor Edwards have said, you can't wait until you're at capacity of your hospitals because it's too late. You can't turn that ship around that quickly. One of the good things about this is this virus, it does not spread by a fact of life. It only spreads if people let it. You have to be relatively close to someone, more likely if you're indoors, certainly more likely if you're unmasked. It only spreads if people let it. It's not that hard to reduce spread if everyone is playing for the same team on that. Looking ahead to Thanksgiving, I think folks will know that the CDC, the Centers for Disease Control, earlier today asked people across the country to avoid travel for Thanksgiving and limit their gatherings to people already in their immediate household. I want to talk a little bit about why they said that. They said that because at this point in the pandemic, we know risk of transmission is higher when you bring people in to your household pod. It's higher when you're indoors. It's higher the larger your gathering size is. And it's higher when you're enjoying food or a beverage because your mask's not on at that point in time. And that's the science behind that. The other part of it is temporally where we find ourselves right now in the country. And this is really what drove the CDC's announcement today, their recommendations. We're in the middle of a very large increase in the country. And look, you never want to throw fuel on a fire, but you certainly don't want to do it when the fire is about to jump the street. This is the most inopportune time, unfortunately, to have the holiday season come upon us. And it's going to require some sacrifices, and that's what was driving the CDC's decision today. Difficult sacrifices, no question, but in the grand scheme of things, reasonable ones. So for families out there, think about what you're really thankful for this season. Think about who you're really thankful for this season. Think about what you want to be there next Thanksgiving as well. Now, I was listening to Dr. Thomas talk about denial of COVID, anger of COVID in response to the excellent question. And there's an interview that's been going around social media that I wanted to mention because I think people should watch it. It was an emergency department nurse in South Dakota. She was interviewed on CNN a week or two ago, and the clip is out there. She was describing her experiences caring for patients who had such anger. They did not believe in COVID. They were so angry at everyone about what was going on, refused to accept it. Families refused to accept it. And they had that anger and frustration literally up to their dying breath. It's just heartbreaking. And for families that are considering what they want to do in Thanksgiving, just think about that. This is a tough situation, but don't make a bad situation worse for yourselves or your family. One of the more uplifting things to think about now is that every day we get more encouraging news about the vaccine. And now we have 2 candidates who we believe are going to be over the 90% efficacious. That's excellent news, much better than we had expected. And this really is a light at the end of the tunnel. I mean, widespread dissemination and administration of the vaccine is the way out of this. This is a real light at the end of the tunnel, and that is really encouraging. It's really encouraging to me as a public health practitioner and as a doctor. There's some peril in that I wanted to close with, and that's we still got to focus on what's important right now. Got to keep our head in there. Like the vaccine is going to be made available. We're working closely with hospitals across the state. The big questions we don't know the answers to. We don't know how much. We don't know when. We do know the first very limited allotments will go to frontline hospital personnel. Right now, until there is vaccine available for the general public, which is still a number of months away, we need to be doing all we can to help one another. And this is like a team going into the fourth quarter after a decent effort the first 3. Coach Payton likes to say you got to finish strong, and that's what we have to do right now. I'll tell you, coming into the fourth quarter, the first set of downs takes us right through Thanksgiving. So I'd like to ask people to keep their eye on the ball with that. Be happy to answer any questions if there are any. Okay. Governor?
Thank you, Dr. Thomas and Dr. Canner. And in order to make sure we're communicating with the people of Louisiana, we are using lots of football analogies today, which are particularly effective in communicating with me, so I appreciate it. Look, Thanksgiving's a week from today. Again, if we insist on this Thanksgiving looking like last Thanksgiving and the other Thanksgivings we've come to know and so forth, then we make it very likely that Christmas, a month from now, is not going to be one that your family is going to be able to celebrate. We make it much more likely that there will be additional seats at tables that won't be filled. And it really is that simple. On the other hand, if we will do what is required, what we know works, if we will avoid crowds, if we will mask up, if we will socially distance and wash our hands and stay home when we're sick, there is every reason to believe today that next year when we have Thanksgiving, we will have much greater normalcy and we will be able to gather together and to celebrate. And do so in a fashion that we can probably not even conceive of today in terms of the amount of Thanksgiving that we will be able to enjoy in terms of giving thanks for all of our blessings at that point. But we're not there yet. We have some work to do. And we talked a little bit today about coping mechanisms, and I think it's just a function of human nature that when you're in a situation and it's a dangerous situation and you perceive that you have very little control over it, that one of the ways that you can reduce your anxiety level is to minimize the danger, or you can deny that there's any danger at all. It's a coping mechanism. It's psychological. Two things about that. Individuals may feel that way, but that would be a terrible way to manage the public health emergency. It would be a complete disaster. Secondly, it shouldn't be necessary because it is not true that we don't have any power over this virus. We do. We know how it's transmitted. We know how it's contracted. Wear the mask. We now know that that protects the wearer in addition to protecting those around the wearer. So just some things that really trying to impress upon the people of Louisiana, we do have that role to play. We do need to be good neighbors to one another. We do need to love one another and our families. But we express that love differently now, given the danger that is out there. So let's all do our part. With respect to the vaccine, I do want to echo what Dr. Cantor said. There is some good news on the horizon. It is possible that we will start administering the vaccine in relatively small numbers to frontline healthcare workers, perhaps before the end of the year. The second group of citizens that will receive priority vaccinations when that vaccine becomes available to us will be those in nursing homes, assisted living centers, and other congregant settings. We don't know exactly when these vaccines come. We don't know how many will be in the initial allotments, how many doses. But what we do know is going to take a number of months in order to get to the general population and to have enough people vaccinated that it makes a real difference in terms of our ability to control this disease. And so I think it is fair to say that there is light at the end of the tunnel, but I just want you to know that is a very long tunnel. And if we want to live to see it, there are some things we have to do today and continue to do until we can finally put this in the rearview mirror. And with respect to the vaccines, I do want to say, and this was a big point of the call on Monday with the Vice President, in addition to him and Dr. Birx and Dr. Fauci and Dr. Redfield and Secretary Azar all stressing the importance of all the restrictions and mitigation measures that will allow us to get to the vaccine. They call it a bridge to the vaccine. That once we get there, I have trust and confidence that the vaccine will be safe and effective. I'm going to encourage all Louisianans to make sure that they take advantage of that vaccine when they are able to do so. If and when the FDA issues that emergency use authorization, I will have all the confidence in the world that it's safe and effective, and that no steps that were critical to ensuring either the safety or the efficacy have been skipped. They haven't been abbreviated. They've just been done simultaneously rather than sequentially in order to speed the delivery of these vaccines. And one of the reasons we're going to have a number of doses available so early is because taxpayers in the United States underwrote the risk associated with mass production of vaccines that might actually get thrown away and never used. No company would ever do that before, but that's the difference here. And so while these things were undergoing their trials and the data was being accumulated and analyzed and all this other work that's taking place, the vaccines have been mass produced. And so when they get that stamp of approval, they will be safe and effective and ready, not in the numbers that we need them, but in the tens of millions of doses, and some part of that will come to Louisiana. So I do want people to understand that safety and efficacy will be there for these vaccines once we have them here in Louisiana and start to administer them. In terms of state government, we are communicating with all cabinet heads that they are to allow more people to work remotely where possible. We're not going to be closing offices. Offices that are open to the public, to service the public, will remain open. And essential personnel are going to go to offices that require their physical presence, whether or not they are serving the public. But we're going to go back to more remote work in order to keep people safe and hopefully reduce the transmission of this disease. Okay, at this point, I want to just remind folks that when we surged the second time in July, we were able to get that under control, flatten the curve, reduce the transmission and so forth, but we didn't have to go back to the shelter-at-home order that we had issued the first time. In fact, the only real adjustments we made, if you will recall, is we put in the mask mandate, and we did close bars for on-premises consumption. All the other things were relatively minor. And as we look at going forward, it is not my intention to go all the way back to a shelter at home. We won't need to do those things. And I don't have an announcement for you today, and I know that you're still going to ask questions. Nevertheless, we are looking at all the data. We're looking at what other states are doing. We're looking at what's being recommended by the White House Coronavirus Task Force and so forth. But what I can tell you is the masks work. Social distancing works. Staying home when you're sick works. And that's what we're asking people to focus on right now. Because if we would all do the things that are actually in the phase 3 order that we currently have in place, our numbers will improve. The question is, are the people of Louisiana too fatigued by COVID to where they're not going to respond this time? I hope and pray that's not the case. I don't believe that's the case. Louisianans have always been resilient and strong people. We're asking you to be resilient and strong again. But we will keep looking at the data, and if adjustments are needed, either when we renew the public health emergency by proclamation as it currently expires on December the 4th, or whether we have to do it before then, we will certainly let you know. But we will do it as necessary to ensure that we don't lose the capacity to deliver life-saving care to the people of Louisiana, those with COVID and those who don't have COVID. So with that, we will take a few questions. Yes, sir.
Governor, for people who have been following this closely since the beginning, it really seems like people's mindsets and behaviors that you're pleading with them to change don't really change until there's new restrictions. And I think that graphic you have on the TV right now sort of shows that. The last one, mask mandate, bar closures, the curve turn. Why not just make the move early as soon as we're seeing this with, knowing that people are really not going to change their minds?
Yeah, I think there's one big difference this time, and that is, unfortunately, the petition and the message that erroneously communicated to people across Louisiana, and people who relied upon it to their detriment and to the detriment of the state. believing that the restrictions and mitigation measures were no longer in place, and if they weren't in place, they must not be necessary. Why would it be necessary if we don't even have a public health emergency? Can you imagine? Dealing with COVID-19 the way that we are, and the people of Louisiana were being told by the Attorney General, no less, that we didn't even have a public health emergency and the restrictions and mitigation measures were no longer in force and they were encouraged to disregard them. Now that that's been proven wrong, and we do have a declared public health emergency, and by the way, we have one in fact as well, and the mitigation measures remain in place and the restrictions remain in place, that's why I believe we have an opportunity to better communicate with the people of Louisiana and get them to resume the behaviors that were successful in reducing the second surge and allow us to get control of this again. But if we need to do additional restrictions, I mean, we are going to do that. My obligation, not just the authority that I have under the Constitution, but my obligation to the people of Louisiana is to protect the public health. And we're gonna do that in Louisiana. Yes, ma'am.
The conversation that you had with the White House, the report indicated that the coronavirus task force thought there needed to be additional restrictions of some kind. In your conversations with the White House, did they give specific ideas of what they would like to see done differently than what Louisiana has in place now?
No, they didn't give specifics, and you know, I brought the report here. I think you all have all seen it. We gave it to you, right? It's basically it says current mitigation efforts are inadequate and must be increased to flatten the curve to sustain the health system for both COVID and non-COVID emergencies. Exactly what I've been saying, what Dr. Thomas has been saying, Dr. Cantor, and other people have been saying for a long time. So we're talking about mitigation efforts being adequate. The efforts by the people of Louisiana right now are, as a whole, collectively, and I'm not fussing at everybody. I don't like to be thought of as fussing, period. But the mitigation efforts being put forth by the people of Louisiana over the last few weeks are inadequate. What we need them to do is to mask, to social distance, to wash their hands, to stay home when they're sick, to protect the vulnerable, to get a flu shot. All of those things. We need those behaviors. Those things are still in the executive order. So I agree 100% with what the White House is saying. I'm asking the people of Louisiana to agree 100% with what Dr. Birx is saying and what the Vice President told us on Monday, because they are exactly right. We have to do better. The effort in Louisiana is inadequate to the task. Yes, and this is going to be the last one because I know that I have a very important call at 3:30.
Governor, it seems clear based on some reporting by USA Today that there was pretty rampant sexual abuse and some cover-up at several levels of LSU athletics. Do you think Coach Ed Orgeron or any other members of LSU athletics need to be fired over that?
No, I am not prepared to say that any individual needs to be fired. What I am prepared to say is that I was extremely troubled by that article. Look, allegations of criminal misconduct, whether it's sexual in nature, violent in nature, on that campus. And by the way, some of it was related to athletics, some of it was not. Some of it was related to the Greek system and to others who weren't involved, I think, in either the Greek system or athletics. But we have to take this very seriously, and we cannot tolerate any instances where someone might willfully turn a blind eye to credible allegations of this type of violence and abuse. And if that happened, we need to know about it. And so there needs to be a prompt, thorough, and transparent investigation so that we can really know who knew what, when did they know it, was it credible, and what did they do about it? Because quite frankly, there's no way that you can get to the bottom of that by reading that article, but what that article can do is excite you and make sure that you do the investigation, and that's what I'm calling upon LSU to do. But I can't sit here today and say that I know that any individual currently or previously at LSU played the type of role that I just talked about being something that is just unacceptable. So with that, I want to thank you all. Our next press conference, we believe we will hold it on Tuesday of next week, and we will do it at 2:30 p.m. unless we have reason to get with you before then. And if so, we will let you know. So please have a good weekend. I'm asking the people of Louisiana to take this seriously. Let's rise to the challenge, at least this time, one more time. Let's do what we know works. Let's all play the role that we have. We all have a part to play. And if we do that, and by the way, I'm confident that we will, because there's nobody out there who has a reasonable argument against what we're asking you to do. And so I'm confident that we're going to come together. We're going to flatten the curve again. And if we can't do it for any other reason, let's be good neighbors to one another, and let's be good neighbors to those doctors and nurses and respiratory therapists who've been working so hard since March. And I'm optimistic that we're going to get that done. So I'll see you on Tuesday of next week. Thank you.
Yep, we can make signs and big colored backgrounds. I'll get